Hello, good morning everyone, or good afternoon, however it pertains to you. My name is Joe Stringfellow, and today I will be talking to you guys about what's radiology, or what's the different types of radiology. Hopefully by the end of this discussion, you'll be able to understand the different types and what it actually is. So let's say you go to your doctor's office, and he tells you go down and get a CT, or go get an ultrasound, or even go get an MRI. You might not know exactly what that means or what they do. So first of all, we need to talk about what is radiology. What's the radiology department when you walk into the hospital? Well, the radiology department is a department where they could use different techniques and different machines to see inside the human body. We're almost like a mirror of the human body, but you get to see the skeletons, you get to see the muscle, you get to see the organs and veins. It's pretty cool stuff. So first of all, let's talk about the most basic type of radiology, which is X-ray. X-ray is used to see bones and any soft tissues like lungs, or if you swallow a penny, to see inside your stomach. We also use X-ray a whole lot for stress fractures or just normal human fractures. X-ray is the most basic and cheap thing that we ever do in radiology. Any radiographer that do ultrasound, MRI, CT, mammos, anything are going to have a degree or a certificate for basic X-ray. Second of all, let's talk about what I do, which is one step up from X-ray, is CT, or back in the day they called it CAT scans. CAT scans are not just for your head. We use a CAT scan for your whole body, just like normal X-ray. But CAT scan is more dynamic. It can give you a 3D image, or you can see slices of the human body. With a normal X-ray, you're going to see a hand, just like this. But with CAT scan, you turn that hand and you're going to see slices all the way through that hand. CAT scan actually gives you a lot more radiation than a normal X-ray, but the benefits and the diagnosis for the doctors are so much more better. So we covered X-ray and we covered CAT scan. So let's cover something outside the means of radiation. Let's talk about ultrasound. Now, ultrasound is in the radiology department because they use the basic same views that you're going to see with X-ray or CT. You're going to see different contrasts with it. But the big difference is with ultrasound, you're actually using sound waves instead of radiation to see the human body. And no, ultrasound is not just for pregnant women or seeing babies. We actually use ultrasound for a lot of things in the human body. Blood clots in the legs, arms, and upper body, we use it for that. We also use it to track different things in the human body. Ultrasound is one of the most commonly used techniques in the hospital nowadays. A doctor will rely on ultrasound more than anything else now when they come to school. Now that we talked about ultrasound, let's talk about something else that's pretty cool. MRI. MRIs are the expensive man CT. There's no radiation, and it's using a magnet instead of radiation, which is pretty cool. It's going to change the way the body interacts to see images of the body. It's a long and very dry explanation for it. But just say the magnet pulls water molecules around, and then that's how you see the human body. Simple as that. So we have MRI, we have CT, we have ultrasound, we have normal X-ray. We also, in some departments, have something called mammo. Mammo is when we use basically normal X-ray to look at breast tissue for men and women. It's not just for women. It's the most used technique to check for breast cancer. You also can go to the lab to check for breast cancer, but it costs way more. Mammos are the most inexpensive and cheapest way to check for breast cancer. If you ever think you have a lump or something like that, you should automatically ask your doctor for a mammogram. Normally you start around the age of 40 to about 75 for mammograms. You should get it every single year at that. So now we talked about mammos, X-rays, CTs, MRIs, and ultrasounds. Today I hope I'll broaden your horizon, open your eyes, and let you see what's the different things we use in the radiology department. Also covered what is radiology. Hopefully next time you go to your doctor's office, you know a little bit more when they're telling you go get a CAT scan. It's not just for your head. I hope this was very informative for you guys and you have a better understanding of what's radiology. Thank you.